This is Nursing Australia, proudly brought to you by APNA, the Australian Primary Healthcare Nurses Association.
Welcome to Nursing Australia. I'm Karen Cook. I'm thrilled to be hosting another episode. If you're a first-time listener, hello, nice to meet you. And if you're returning, welcome back. We've got a jam-packed episode, so let's get right to it. Today, we hear Melissa's story as she shares the joys of being an aged care nurse.
I physically don't have any grandparents living, but I've got 75. You really become a part of their life, and even if you try not to get attached, but you just can't help it.
We also discuss the importance of scheduled vaccines and catch-up programs, especially considering immunisations may have been delayed due to COVID-19.
You have to collect the evidence. Nurses are almost detectives now when it comes to this stuff, and they're really, really good at it. But we can give you a bit of a list on things that you can use to do that.
We learn more about the proactive and compassionate initiative that is APNA's Student Nurse Placement Program.
We also have this unique opportunity to hugely impact the next generation of nurses.
And finally, we will be guided through a self-leadership scan. This is sure to be a quick and easy way for us often time-poor nurses to indulge in some much-needed self-care. But first, here's the news.
In this bulletin, nursing degree fees slashed, APNA's student placements program takes off, new guidelines for spirometry testing, and the only survey nurses need to do this year.
This is Nursing Australia News.
Hello, I'm Tony Wells. Nursing degrees have become more affordable thanks to a shake-up of university funding by the federal government. From next year, Australian students will pay just $3,950 to study nursing, and that's a 42% reduction in the cost of a nursing degree. Federal Education Minister Dan Tehan says the change is part of the Morrison government's Job Ready Graduates reforms.
Nursing graduates enjoy strong full-time employment outcomes, with a full-time employment rate of 76.3% compared to the graduate average of 72.2%. Australia is going to need more nurses into the future, and what we're hoping is through these changes, more people will want to study nursing and more people will want to become nurses.
Meanwhile, still on education, more than 400 nursing students will be getting practical exposure to primary healthcare thanks to APNA's new placements program. APNA has been working with Monash University and Victorian General Practices to ensure the students can get the necessary placement hours they need to graduate. This has been a challenge for hospitals during COVID-19, leading to a potential backlog of graduate nurses entering the workforce. However, APNA members and their employers across Victoria have come forward to give a helping hand to the next generation of primary healthcare nurses. The program offers each student 120 hours in a primary health care setting with supervision by an experienced registered nurse or nurse practitioner. A national survey aims to give primary healthcare nurses a say in the future of health reform. The 2020 APNA Workforce Survey was launched in November. It's open to nurses working in general practice, aged care, Aboriginal and Torres Strait Islander health, plus every other non-hospital community setting. Survey data gives government and policymakers a comprehensive picture of the working conditions and professional concerns of primary healthcare nurses across Australia. APNA CEO Ken Griffin explains why this is so important.
The APNA Workforce Survey helps us ensure that the work of every primary healthcare nurse is valued, visible and respected. To change policy, we need data, and the data you give us by doing the survey enables us to take your voice right to Canberra to get the changes we need in our health system.
That was APNA CEO Ken Griffin speaking there. Go to the APNA website for a link to this year's survey and your chance to win a $1,000 Red Balloon Experience voucher. The National Asthma Council has released new spirometry infection control recommendations for primary care. The guidelines have been updated to reflect the current low number of COVID-19 cases, but are subject to immediate change should case numbers begin to escalate. We're sad to report that COVID-19 has now killed more than 1,500 nurses around the world, according to a new report by the International Council of Nurses. That's more than the total number of nurses who lost their lives during World War I. In the face of this tragedy, the International Council of Nurses has been calling for standardised and systematic collection of data on healthcare worker infections and deaths. ICN CEO Howard Catton says it's a scandal that this hasn't happened yet. And it's over to the United States now, where nurses will be honoured in a star-studded Thanksgiving Day concert. Gloria Estefan, Stevie Wonder, Pitbull and the Black Eyed Peas are among the entertainers performing for Nurse Heroes Live. Funds raised will be donated to programs including scholarships for nurses and their children. The concert is being hosted by Whoopi Goldberg, with special appearances by Oprah Winfrey and Billy Crystal. Nurse Heroes Live will be streamed on YouTube and Facebook from 7 p.m. New York time on Thursday the 26th of November. That's 11 a.m. Sydney time on Friday the 27th of November.
Aged care has attracted its fair share of negative headlines this year. But, there's another side to working in aged care. For many nurses, it's an incredibly rewarding experience. APNA Board Member Melissa Cromarty is a clinical nurse manager at an aged care facility in New South Wales. She took time out of her busy schedule to speak with ABC Radio Brisbane. This is her story.
With that limited face-to-face family contact, I'll start with the families first, I feel we were forced to change the way we communicate. So it was more open communication and I guess a larger or greater amount of phone contact, whereas when it's face-to-face you would still often miss or not catch up with some relatives, whereas that changed because we took a different focus on ensuring that we were providing updates to the relis. For the residents, absolutely different. We had to take on a completely different role. We had to be everything for them. And whilst we always take on that advocacy role for them, it kind of changed. I think it was a greater social and emotional support for them, and we were really focused on that, understanding that social isolation for them was really going to impact them hard. So I guess we changed our whole program. Our lifestyle program was changed to be a lot more one-on-one, because obviously we couldn't even really have our residents in big groups to do activities, or we couldn't have concerts, so the staff had to do that. So that was entertaining. I wouldn't get an entertaining gig anywhere ever, just saying. But whilst it was all stressful, it has been fun as well. So we were able to think of innovative ways to get our residents to communicate with our relatives. So we were using a lot of FaceTime, Snapchat little clips that their families really loved, or just, talking videos that were sent out via mobile to the relatives just to show that everything was okay, where the resident could communicate via video link, I guess, with the relatives. And then that's been captured. Many relatives have said, oh, that's awesome, we're just going to have that forever, where you might not have thought about doing that before. I physically don't have any grandparents living, but I've got 75 of them, not 75 of each, but, pretty much half and half, grandpas and grandmas. You really become a part of their life, and even if you try not to get attached, but you just can't help it. So it is rewarding, and it's great. I've been to 100th birthday celebrations. I think we've had 4 of them during COVID. Oh, wow. A 60th wedding anniversary, which was amazing. Lots of other milestones that we've helped our residents celebrate, which has been really good. I'd never had that when I worked in the emergency department, so that's been nice. They are just chomping at the bit to go to the shops. They can't wait. They're really excited. You can see just a general change in the residents on a whole. We've started back with bus trips and not that we're taking our residents anywhere, in large groups, but just, drives around the beaches and just to get them out of the environment, which you can already see it's been really positive in making them feel a bit better. And contact with families has been great as well. Whilst if we identified that anybody was deemed palliative, we certainly were not keeping relatives away. They were able to come in, but that was simply just to limit the flow and obviously not to make families be apart from one another during that time. But it's great to have the families back on board and back in. We've missed them.
Many thanks to Drive ABC Radio Brisbane for that audio. We'll be right back.
APNA's Nurse Support Line provides primary healthcare nurses with access to timely, relevant and accurate advice, resources and referrals. If you need support, please call 1300 303 184.
As nurses, we know vaccines play a vital role in ensuring a healthy Australia. Federal and state governments have developed schedules to keep our citizens' vaccinations on track. But with a global pandemic comes shifting priorities, and scheduled immunisations may have been delayed. APNA's very own nurse educator, Suzanne Blackby, joins me to discuss this important topic. Welcome, Suzanne.
Oh, thanks so much for having me. We're talking about this right now, catch-ups, as 2020 has brought an added level of uncertainty around potentially missed vaccines for nurses and their patients and their families that they care for. So, it's an important topic to cover.
Could you tell our listeners a bit more about the catch-up program?
So we're in a fantastic position in Australia now. Nurses have the ability to assess patients, to look at evidence, and to give a tailored approach to an individual for any immunisations they might have missed. But the first thing we need to think about in how to do that and how to get to that end point of a catch-up schedule is to work out what's already been given. That's the only way we can work out what's been missed. You have to collect the evidence. Nurses are almost detectives now when it comes to this stuff, and they're really, really good at it. But we can give you a bit of a list on things that you can use to do that. So a good rule of thumb when looking at someone's past immunisation history is that if you can't prove it, nurses can access the immunisation history statements from a patient's Australian Immunisation Register record using PROTA. If you haven't already got PROTA up and running, PHNs can be a great help for nurses in dealing with the registration process for accessing the PROTA portal. The Blue Book has been around for a really, really long time. I'm sure you've got one, Karen, hidden in the bottom drawer somewhere, or a box of them for your own kids somewhere. If there's information in the Blue Book that hasn't been added to AIR, nurses can add that if it's not already there. There's also some apps around like Save the Date and Vaccidate. If parents and families have that app, it can also show you any missed vaccines or doses or things that are due that you can add into your calculations. One of the really tricky ones is overseas immunisation records. I think we all shudder a little bit when we see overseas immunisation cards come into the treatment room. If they're in English, that's probably not too hard to interpret, and nurses may be able just to upload that data into the AIR record. If it's in another language, then the PHUs, the public health units in your area, can be really helpful in deciphering different language vaccine records. Also, don't forget the school program records. As I said, states and territories are adding these records from the school programs to the Australian Immunisation Register, but it's a slow process as these are all paper-based records. So if a patient's school record is incomplete on AIR, nurses can request the program records from their local PHU where they're held and add them up. Families may also have written record cards from the school program that you can add into AIR if they're not already there. School program vaccinations can be caught up in two ways, within the school program itself or also they can be caught up at your local general practice. Sometimes previous GP records could be helpful if a patient has moved or changed general practices. Nurses can help patients access their previous records from previous GPs or maternal and child health clinics and add those up to AIR if they're not already there. Another thing to consider is workplace immunisations. Lots of workplace immunisations are happening out there now by corporate providers. So if individuals have workplace immunisation records, nurses can also add them to the AIR record as evidence.
What do nurses have available to them to establish a catch-up schedule to ensure their patients get the best protection?
Okay, so now you've done the hard bit. Now you've collected all the evidence, you've updated the record on AIR, and you've got a starting point. You now know what vaccines have been given. And this is where we can start to look at what's been missed. So for children under 10 years of age, the new catch-up calculator available through the handbook is great. It's a lifesaver. The nice thing about this calculator is it takes into account the age of the child now. And this is particularly relevant as there's some vaccines that are age limited on the schedule. If a 5 or 6 year old child has never had rotavirus vaccine, that's not one that we would catch up because it's only recommended for children up to the age of 6 months. The calculator also takes into account what state the child lives in. So as well as the NIP, some states have some specific vaccine schedules as well, and this will be taken into account by the catch-up calculator. The calculator also looks at Indigenous status for Torres Strait Islanders and Indigenous children. Now we know that the schedule varies for these populations, so that's an important one to make sure we indicate in the calculator if a child requires the additional schedule or the age changes for Indigenous populations. The other thing the calculator lets us do when entering vaccines that have already been given is it lets nurses enter them under specific antigens or the name of the vaccine. Now, this is really helpful for kids who've had vaccines overseas, as the brand names of those vaccines won't necessarily be familiar to Australian nurses. Also, the combinations of antigens in each vaccine may be different. So it's really great to have a choice on how we enter each vaccine and have that option of entering it under antigens as well. But, you know, if it's really tricky and there's lots of contributing factors and you're not confident or you're not sure or you need someone to have a second look at this, then your local public health unit are a fantastic support. Talk to them about any concerns that you have. The handbook also has more information on complicating issues, so children and adults with at-risk medical conditions, and as well, states and territories have specialist immunisation services for more complex cases. So non-responders to particular vaccines or previous vaccine reactions that you're concerned about. To find this information, go to the Ministry of Health in your own state or territory and you can access the specialist immunisation services there.
Finally, could you tell our listeners more about the current state of vaccinations in Australia?
So here's the good news story. You know, anecdotally, we were very, very concerned about the drop in face-to-face presentations in general practice and other health settings over a COVID pandemic year, and that potentially could impact our immunisation rates. But what we do know is by the numbers released by the federal government at the beginning of November, we're doing better than ever. And congratulations to all the primary healthcare nurses out there who've worked really hard to maintain the childhood immunisation schedule during a really difficult time. So our goal, our aim in Australia is to hit the 95% target across children up to the age of 5. And for the first time ever, we hit 94.9%. So we are so close. So that's an amazing accomplishment. What we don't know is how the data is sitting around children and young adults and adults over the age of 5. As I said, anecdotally, we know that there hasn't been as many face-to-face presentations for people. So we also know there's been a significant interruption to the school immunisation program. So young adults and teenagers may be at risk there. So some things to think about is when we are talking to families is to think about the age groups above 5 and where there might be opportunities to catch any missed vaccines up. As well, with face-to-face presentations being lower than normal, we may have missed that second MMR dose for adults born after 1966. There may be an opportunity to catch them up. Some of the new changes to the schedule for older Australians may need a second look as well. The new Prevnar 13 dose and the Zostavax as something that we should be looking at when we do get back in touch with these populations. And don't forget those people who are medically at risk, so they have those at-risk conditions, they potentially will need some catch-up as well.
What great insight. Thank you, Suzanne. If you'd like to hear more of our discussion, check out the extended version in the show notes. You'll also find links to the resources we've mentioned today. We'll be back after this.
Who has the time to wade through every piece of healthcare news? Primary healthcare nurses certainly don't. Fear not. APNA's Weekly Connect e-newsletter condenses key industry news into digestible content while serving up a feast of useful resources. Stay in the know and save time. Subscribe for free at www.apna.asn.au.
Nurses are all too familiar with COVID-19 and its multitude of devastating and long-lasting repercussions. The pandemic has caused significant distress for student nurses, particularly in Victoria. Many have been at risk of not graduating, as ongoing restrictions have made it difficult for mandatory clinical placement hours to be completed. In response, APNA has partnered with Monash University and developed the Student Nurse Placement Pilot Project. General practices and primary healthcare nurses have been urged to pay it forward. Host a student nurse for a 3-week placement. I'm so excited to welcome APNA's founder, Sam Moses, to the podcast. Over the next few episodes, we'll learn more about this wonderful initiative as she interviews stakeholders who've participated in the program so far. Today, she's joined by one of the amazing Nurse Supervisors. Over to you, Sam.
Thanks, Karen. Today, my special guest is Meg Sayers, and Meg is a registered nurse and she's also a registered nurse immuniser. And she began her nursing career back in September 2011, and she had a grad year at Otway Health at Apollo Bay. She's also worked at Royal Melbourne Hospital as an RN, and then she transitioned into general practice. So welcome, Meg. Meg and I know each other because of the APNA Student Nurse Placement Program that we've been running through Monash University, and Meg is one of our wonderful nurse supervisors. So welcome, Meg, and I've got a few questions that I'd like to ask you. When you were a student, did you have the opportunity to undertake a primary healthcare placement?
Actually, I did. I had a placement with Bolton Clark in my final year of nursing.
That's fantastic. And so what were one of the benefits of undertaking that type of placement? Was it, had you been exposed to that type of nursing before or even thought about primary healthcare as a career pathway?
I honestly never had. When I had gone through my studies at uni, I definitely was only given hospital placements and aged care placements. And so I felt quite destined that I was going to only be an acute care nurse. And then my experience with Bolton Clark actually allowed me an opportunity to see what it means to take care of people in the community and to allow them to maintain their independence at home. And it was a really unique opportunity that I found so insanely beneficial, because not only did it allow me this opportunity to actually see the different sectors of the healthcare services that we provide, but it also allowed me the opportunity to see what happens when people go from hospital and how they're taken care of in the community. Having that community placement really allowed me to get a proper understanding of the Australian healthcare system. I think student nurses would find any placement in general practice insanely beneficial, and that it should definitely become a normal part of their university experience. It allows them an opportunity to see healthcare outside of the hospital setting, but not before it hits aged care. And the process of what a general practitioner does, what a practice nurse does, the referral process to specialists, and the services that are actually available to maintain someone's independence.
So, Meg, we know that there's a shortage of clinical placement opportunities in Victoria, and I believe also, in the whole of Australia. There is definitely a finite number of clinical placements and less than what the students are needing to be able to fulfil their clinical requirements to become registered at the end of their degree. So how did you feel, and what was the thing that drove you to want to be a part of the Nurse Supervisor project?
Initially, I wasn't that inclined to take on a student nurse. However, when I realized how dire the situation is, and then I talked to a few students and they told me that their placements in hospital settings were being cancelled and that they weren't going to be able to complete their studies until their placements had been completed, drove me to feel passionate about taking on a student nurse. And it was honestly the best decision I could have ever made, because it not only allowed our clinic to feel re-energized after being in a lockdown for so long, it also just allowed us an opportunity to mentor someone one-on-one very specifically and provide them that opportunity to continue on with their nursing degree. And we need to ensure that as many people as possible are taking on these students so that they can continue to grow their opportunity and be able to complete their degree at an appropriate time.
So what are some of the things that excite you, and what did you find rewarding about having the student there in the clinic? What did you enjoy, and is there a little story about something that you could share with us that happened?
My student was so incredible to have. She was incredibly intelligent. She was able to perfectly replicate things almost instantly, and she was so enthusiastic, and she was so great with the patients. And I remember we had two young patients come in who needed to do some catch-up immunizations, and because they were a bit older, they were very, very, very nervous, and my student nurse was able to perfectly distract them throughout the whole process, make them feel incredibly comfortable. So the things that I found rewarding about the whole experience is just to see nursing again through her eyes, and to be able to feel that excitement and enthusiasm over the smallest things all over again, and that discovery that's involved with learning things all over again. Everything that I did, she wanted to learn, and I forgot how exciting it can be to be doing this. We also have this unique opportunity to hugely impact the next generation of nurses, and she just kept telling me over and over, she said, I feel so fortunate to have had a supervisor like you, and that was fantastic.
Oh, that's really good. And I guess, did it open her eyes to primary healthcare as well? Did it exceed her expectations, do you think, about the preconceived idea about what she may have felt about the placement before she actually, completed it?
Absolutely. She, I don't know what her prior opinions or thoughts were about community nursing, but she told me that she knew very, very little about the healthcare sector. And so in our downtime, I spent a lot of time actually just teaching her about the different sectors, about what we do, what we can provide, the processes behind it. We covered we covered topics like Medicare benefit scheme. We covered chronic disease management plans. I showed her all the different websites that the government has and different resources available, which she definitely did not know any of this before the placement. And I feel that she found it very, very beneficial. And we had these opportunities to have these discussions as well in the downtime, which was something that I know that when I was a student nurse, I didn't have these opportunities to have with any hospital nurse, because we were just inundated with work. And that's not to say that you're not inundated with work in general practice, but depending on where you work, there might be a little bit more downtime to be able to see this and observe it happening.
So what do you think the program has taught you? What do you think have you developed any extra skills, do you think, through this program, having the student there with you?
I think it's just grounded me a little bit to remember to not make any assumptions about what we think people know. I think it's so easy that when you have developed a basic knowledge and understanding of things, to forget that not everyone else has, and to make the assumption that student nurses and nurses in their early careers are going to have this knowledge. They need someone to show them that knowledge. And if they don't have the opportunity to be shown this, then they'll miss out, and then it might not be 10 years until they learn a particular thing.
Thank you. And what about nurses who might be listening to this podcast out there in primary healthcare land? Have you got any advice for nurses who are in the position or are even interested in participating in the Student Nurse Placement Project? What would you like to say to them?
I think you should just do it. It's a great opportunity, and even if you're nervous or anxious or you don't feel that you might be good enough, know that you are. And know that the students will be so grateful for the fact that they can even just be with you and they can just watch how you work and watch how you practice. The students are optimistic, they're enthusiastic, they're excited for these placements, and they want to learn and they want to be there with you to learn. And they're honestly not extra work. They're so happy to do wound dressings and to help with the cleaning process. And as long as you feel comfortable to have someone with you during those times, then you'll find that it's not any extra work at all.
Thanks, Meg. That's been really lovely talking to you.
This project is off to a flying start, and APNA is looking to expand it nationally. Nurse Supervisors play a key role in this project. If you are interested in learning more and you're an Australian-based registered nurse or nurse practitioner, Sam would love to hear from you. Please reach out via the email address provided in the show notes.
Nursing Australia, the podcast for Australian nurses working together towards a healthier Australia.
As Nurse Robbie highlighted in last month's episode, wellness is multifaceted. Our physical, mental and financial states contribute to our overall well-being. But other factors such as relationships, career and environment can play a part too. Because wellness is so complex, it can be hard to pinpoint the aspects affecting us the most. We welcome Dr Avi, a global expert in the science of health, organisational and business resilience. He will guide us through a short self-care exercise, which will help us understand all the domains of life and identify the areas we should be honing in on.
Thank you to Nursing Australia for inviting me to share this podcast with you on essentially wellness, self-care and resilience for nurses. I'm Dr Avi, as mentioned earlier, and really what I want to share with you in the next few minutes is helping you really identify where it is that you can focus your efforts in improving your well-being and your resilience. You see, so many nurses now are really challenged with being extremely fatigued, feeling like they don't have enough time to actually constantly be tired, and also with everything that's happened with COVID, actually, feeling at risk in terms of, bringing infection at home that affects work, family, and trying to balance and juggle all the different responsibilities that you have on a day-to-day basis. That so many nurses tell me that they don't have time for themselves, they don't have time for self-care. And so what do you do about this? So in my last few years in working with healthcare professionals and 25 years of being in the healthcare industry, one of the things that I've found and developed is the 6E methodology to help people achieve that better self-leadership and help nurses achieve better resilience. But with all the challenges that people have, one of the things that often nurses struggle with is knowing where to focus. Where do I start first in this area? And so right now, I want you to think about 7 domains of your life, okay? The first being your mental state as being number 1. Your physical state, number 2. Social and relationship state, number 3. your financial domain, number 4, your career, number 5, environment, number 6, and spiritual, number 7. Now, for each of those areas, I want you to rate yourselves 1 to 10. Okay, and I will repeat this again. And if you don't know how are you going to rate yourself 1 to 10, let's start with your physical. So these are some questions that will help you rate yourself 1 to 10. Do you agree or disagree with the statements relative to your physical score? Number 1, my body is in excellent health. I have a healthy diet. I'm in excellent state of nutrition. I exercise regularly and I get sufficient rest and sleep every day. Okay. Now, just for that, that's your physical state. Rate yourself 1 to 10. Just one score for the physical score. Next, let's look at mental. So mental, these are the statements around your mental state. I get sufficient intellectual stimulation in my life. I am in excellent emotional health. My current behaviors help me cope with my daily challenges. I have sufficient opportunities to think creatively. I get sufficient challenges to learn from in my life. Okay, how much do you agree with that? Score yourselves 1 to 10. Next, your social and relationship scores. Here are the statements. I have strong connections with my family members. I have strong relationships with my friends. I have healthy romance in my life. I have strong connections with my community. Okay. Score yourself between 1 to 10. Just one score for social relationships. Next, let's look at your environment. Here are the statements. My home space is conducive to my well-being. I have regular contact with nature. I have appropriate spaces or places for recreational activities. Score yourself 1 to 10, just based on those questions for the environment score. Next, let's look at your career score. I have a sense of fulfillment in my career. I have a sense of balance in my current career choice. My career is aligned with my unique values and beliefs. Score yourself 1 to 10. Finally, financial score. I have a sense of financial abundance. I feel secure with my financial state of affairs, and I have a clear plan with my financials. How much do you agree with that? Score yourself 1 to 10. Finally, your spiritual score. I have a sense of inner peace and happiness. I'm living in alignment with my personal values and beliefs. I'm living in alignment with my higher purpose. Score yourself 1 to 10. Now, you should have given yourselves 7 different scores, or some of them may be the same, for all the different areas of your life. This is a tool that we call the Self-Leadership Scan that's available on our website, selfleadershipfornurses.com. But this tool is basically something you can just write down on a piece of paper based on the statements and the questions that I've just asked. Rank a score for each of those areas. The areas that are the lowest are the areas you want to start focusing on. I'm Dr. Avi. Bye for now.
The Self-Leadership Scan is part of Dr. Avi's Self-Leadership Experience program. He developed the program to help nurses become more successful in their work and life, especially in this new normal we find ourselves in. You can learn more about Dr. Avi's work by clicking the link in the show notes. This brings us to the end of the episode. Make sure to subscribe or follow so you don't miss our next one. It's sure to be festive. I'm Karen Cook. See you next time.
Nursing Australia, the podcast for Australian nurses working together towards a healthier Australia. For more information, please visit us at www.apna.asn.au. Thanks for listening to Nursing Australia.